Hi, again, it's Anne with Beyond Addiction from Gulf Breeze Recovery. And today we have Dr. David Espenscheid. How do I say that, David? Tell me.
Espenscheid.
Okay, so we have Dr. David Espenscheid. Thanks, David. How are you?
Good.
Good. What I'd like to start with is if you could tell everybody a little bit about yourself, your background and what you do at GBR and how you got there.
Well, I'm by training a family physician, and I guess it's been about 12 years ago, I was approached by Barnett Gilmer to be the medical director for his new rehab center, Gulf Breeze Recovery. At that time, it was we were uncertain about the future. It was more of a hobby for me, but it became my passion as time went on. I myself am in recovery, and it fit right into what I felt that I needed to maintain my continued sobriety, and now it's become quite an endeavor. Yeah.
Wonderful. Wonderful. And that's interesting because you brought up that you too are in recovery. Let's talk about that a little bit. What was your background with substance?
Well, I'm a child of the '70s, and needless to say, I guess that speaks for itself. But like a lot of people in my field, we have access to things like that, and just the series of years as they went by, my use of, in my case, it was opiates and alcohol primarily, and finally got to a point where I needed to do something about it. So it's been 21 years since I've done my drug of choice. And I would like to say it was the first time I went away to treatment, but it took three times. But it finally stuck, and my life's been much better for it.
Yeah, I mean, that's not unusual for more than one visit for it to take. And it's also not unusual for doctors either, is it?
Oh no, in all honesty, I think about the members of my class. I would say easily half of them experimented. The difference is the majority of them, as time went on, quit. Yeah, but there was a certain percentage, and I was in that percentage. I think it's probably higher in my profession than the average. Uh, if you just took the population as a whole, but mainly because of our knowledge of the medicines and access to them, you know, and the
Yes.
stress of the job and all the other things that come into play.
Yeah. Now, describe for the person watching this what exactly you do at Gulf Breeze Recovery.
Well, I am the medical director, so anytime someone comes in and is to be admitted, I'm the first one to evaluate them. We have it's now a 10-bed detox unit. And if they are in the throes of their withdrawal, then we admit them to detox. We do various types. We do opiate withdrawal, benzo withdrawal, methamphetamine, cocaine, alcohol, essentially every one of them. And after an adequate length of time, it averages anywhere from 3 to 7 to 10 days sometimes before they're truly detoxed, as we say. Then we transition them into what we call residential, which is the inpatient program that's in the same building. At that point, they start attending classes, they meet their counselor, they do other things. I guess we'll touch upon the specifics of what they do in residential, but mainly my job as a medical director is to assess them, what their needs might be for the initial detoxification. And we get some pretty sick ones, needless to say. And, if we've had probably in the course of 12 years, I think we've probably had to send out about 4 or 5 to the hospital because their detoxification was just too complex and too severe that we had to let them go. Are we still recording here?
Yeah, we are. And
Okay,
and the
good.
thing the thing I wanted to touch on that I hear from guests is A, the fear of detox, and then B, how comfortable they were at detox at Gulf Breeze Recovery, even though it isn't a pleasant thing, they were made comfortable. Talked about that.
You're going to have to repeat that. You broke up a little bit during that.
Sure, sure. Guests have often told me their fear, their biggest fear is detox.
Yeah,
And yet
right.
they talk about how comfortable they were, surprisingly, at GBR. Talk about that.
Well, most people, I think probably the initial hardest thing that people do who are addicted is to ask for help. And to come into a program like ours, or like most of them, where not only is there the detoxification process, which can be painful and stressful, then there's the concept of staying another 8 weeks for the program. But, in my experience, that's essential. So the initial step, to come into a place where you don't know people, it's a strange bed, it's you don't feel good. Yeah, it's hard. And, you're taking yourself out of your life. You're getting off the merry-go-round for a while. You got family concerns and business concerns and job concerns that you're leaving behind. But one of the things that we do is we try to assuage that to begin with. We talk about it. And I think a lot of times in my experience, the fact that I went through it, that, I share my story almost with everyone. Yeah, and to let them know that I too had sat in that bed, and that I understand what they're going through, and I think a lot of that it sort of segues into feeling better. And plus, the protocols themselves, we use different and various medications, to help them get through. It varies from drug to drug as to what we use, and I don't necessarily want to go into the details of all that, but we do our best to make them as comfortable as possible. I'm honest with them. I tell them they're going to have a few rough days, but it'd certainly be a lot less rough with us than it would be if they were trying to do it cold turkey at home.
Right. And that's what I get as feedback is that it was less less stress than they thought. But they also, the thing about detox is it's not just about getting clean at GBR, it's about getting healthy so that you can participate, mindfully participate in the program. So it's more than just getting clean, right?
Oh, absolutely, absolutely. And in all honesty, sometimes it takes a little bit longer than just a few days to mentally get back to square one. But you get to a point where it's time to get motivated and get with the program. So we've learned how to. I keep seeing this lose reception and go back in. I hope this is all going through. But we try to counsel them. We get their counselors involved early. We try to get them out of bed and start exercising. Diet is a huge part of it. We have a chef that if they have special dietary needs, we try to be sensitive to that. And it's all these things combined together. I think that makes them make comments like that. They say that of all the detoxes they've been to, this is one of the ones that makes them, or at least they felt most comfortable going through.
Right. Yes. You're touching on the whole holistic side of this, and it's about getting healthy, not just getting clean, so to speak. And the
Right,
food,
right.
right? So the food, expand on that a little bit. The exercise, the food, talk about that a little more.
Well, I get tickled sometimes when folks come in and they've been drinking a fifth of vodka a day, but yet they they get upset because they feel like they have to have their, you know, their supplements as well. you know, they say, "Well, I'm really into health," and I have to remind them sometimes that maybe that fifth of vodka is not part of that equation, but it is. It's the whole body approach. It's not just the mind, but it's also the body and the soul, if you will, that needs to get healthy in order for it to work. I mean, I know for me personally, the first time I went to treatment, I just had no intentions whatsoever of getting sober. I was just going to go underground. And second time, I was trying to save a marriage, and third time, I was trying to save me. And that's a concept that I've tried to push to folks is that, selfish isn't always a bad word. And sometimes, if dad or mom isn't healthy, then the family doesn't work very well. So, that's one of the things they need to do is concentrate on themselves. They were given two of these and one of these, so maybe we need to listen instead of talk so much.
Yes, yes. And you've worked with and in conjunction with other rehabs. So if you were going to describe the difference between what you've experienced elsewhere and GBR, from your point of view, what would be the differences?
Well, with ours, as far as the detox is concerned, is it's almost like a hospital setting. I mean, we have 24-hour nursing presence, RN nursing presence at all times, 24 hours, 7 days a week. And I think that makes it much safer for those, especially going through a rough detox. As far as residential, it's a different approach. It's instead of the standard, 12-step program that we hear so much about, which is, obviously been very successful, but isn't for everybody. Uh, we offer one called it's the three P's, which I won't go into details about, but it's a different, more holistic approach. I certainly believe that there's more than one way to get to the end result, which is a clean, sober life. And I really applaud this one. I think it actually has a little bit higher success rate. A lot of people come in, they've been to 12-step programs. Not to say anything bad about a 12-step program. It's just that sometimes it just doesn't fit. And it's nice to have a different approach and a choice, if you will.
Yeah, and how has working at GBR helped you? Does it have an impact on you, the whole program and what you're doing on your sobriety?
Well, it reminds me daily of where I, used to be. And, and it gives me hope. And it gives me inspiration to see folks, go through some of the things they've gone through. I've seen them come in. I mean, we've literally had to, scrape them out of their car and put them in a wheelchair and get them in here. And then, 8 weeks later, they leave, they're walking 5 miles a day. They're smiling. They're thanking everybody for, their experience, and they have motivation and they have health and they have hope about their lives again. So it's a lot of miracles. Needless to say, it's that's what drives me.
Yeah, yeah. And the you get in, do you get involved with the therapists as after people leave detox? Do the therapists come to you at all with issues, or do you get involved at that?
I do. I do. Sometimes we have medications to consider. A lot of times they come in on several medications. Sometimes, in my mind, too many that they've accumulated from their physicians and other rehabs they might have been to. Um, so it's we like to see really what somebody's sort of sober baseline is, if you will. We like to get them detoxed and then just see where we stand. Now, so you can't just stop certain medications, but a lot of times, and I'm sort of from the school of less is more, but a lot of times, you start looking at at things, and they're on two different antidepressants, something for anxiety, something for sleep, and a mood stabilizer and an antipsychotic, and you start thinking, well, maybe that's not the best way to go. We can start removing some of those, and we've had some great successes in that regards. People leaving on much less medication that they arrived with. Not just the drugs that they were abusing, but the ones that we as physicians prescribe for them.
Yes, yes, because we, as a country, we are very much focused on the symptom versus the cause. And my understanding of this program is getting to the root cause is the goal. And sometimes that leads to not needing all of these other crutches.
Well, we live in a world where we're sort of taught from day one that if you're constipated, take a pill. If you have diarrhea, do this. If you want to look better or younger, take this pill or have this procedure. And it's just we're faced with this every day in the media, on TV, and even now on our phones on a daily basis. So it's hard to convince people sometimes, that maybe that's not necessary. We're taught, from an early age to take something, to make us feel better, or to smile, to be happy, and that's not always the case.
Right. And for those of us who don't have an issue with substance, sometimes we're not comfortable. Not everybody every day is always comfortable. So sometimes you just have to work through it.
True that. And that's what I tell people. I said, they say, well, how is sobriety for you? And I said, well, I'm like anybody else. I have good days and bad days. I said the difference is, if my wife and I disagree, and I decide that maybe I need to get away from her, instead of saying, well, I'm going to go to the bar now, I say, well, I think I'll just go walk the dog. And, you know, arguments last a lot less longer, and just life in general. It's what I tell people. I said, look, I'm boring, but I'm predictable. If I say I'm going to do something, I do it. If I say I'm going to be somewhere, I'm there. Uh, you know, it's just not a bad way to live. I think sometimes, we look for boredom. And when I say that, I mean that, it doesn't always have to be exciting every day. I asked one of my friends who's in recovery, when he asked me, did I miss it? And I said, what? He said, when we did drugs. And well, I missed how funny I was. And he looked at me, he said, you weren't funny. He said, you were obnoxious. So I'm boring now, and all my jokes are dad jokes, but I'd much rather live this way than the way I used to.
Right. Right. No, it's so funny because I have heard people think that if they're not using the substance, because so many times it comes innocently to help you cope. And so they think if I don't have the substance, I'm not going to have any fun anymore if I don't.
Right. Yeah, that was a personal struggle. I've done it for so many years, but you do have fun, and it's just, it's a different fun, but fun nonetheless.
Yeah, and I would think that not having to always think about where am I going to get it? How am I going to get it? How am I going to hide it? How am I going to appear not to be using? That's not fun.
That's true. That's true.
It's a lot
And
of time you spend there. The people watching this love stories. Is there a particular guest that came in that made a big impact on you, good or bad, that you think about sometimes?
well, no one in particular. I'm not necessarily prepared for that question, but I mean, yeah, several do. I mean, we've got some that are frequent flyers that come back, and you try your best, to give them hope, and to keep trying again. It's like trying to quit smoking. I mean, drugs and alcohol are the same thing. I mean, very few of us get it the first time. So you try to encourage them to keep trying, and eventually, a lot of them do, and it's wonderful to see.
Yeah, yeah. Um, what is the best thing about working at Gulf Breeze Recovery for you?
Well, uh, just that we work together as a team. It's a lot of times, in at least in my experience, sometimes there's a clinical side and then there's the medical side, and we sort of go our separate paths sometimes, and sometimes they get in conflict. And I think with Gulf Breeze, we've really made a lot of effort to combine the two as much as we can, and we're in contact with each other. We on a regular basis, and on an as needed basis as well. And I think we respect each other, and as a result, I think we do a much better job for the clients.
Yeah, now here's a question you may not have an answer for, but I was interested because I can remember visiting and finding so many books that were, even though I mean, life is life, and whether you have an addiction or not, there's things you want to manage. Is there a book or any book at the library that was something you read or a book that you used when you were in recovery that helped you?
Well, I went through the 12-step program, and of course, there's the big book, which for a lot of people, it's the Bible, if you will. But for me, it was more about interactions with people. I continued to go to a men's group. I'm 20 plus years clean, and I'm the rookie in this men's group. There's others in there that have got 30 and 40 years of sobriety, and we meet every week and talk about our issues. And it's a little different when you're that far down the road, but it's life still gets in the way, and it still offers a lot of obstacles and stress. And it's nice to hear people that have got even more sobriety than you do, and how they handle things. And it's an ongoing process. It's not something you can go do in 8 weeks and then be forever changed. You have to continue to work at it. Is it hard? I would say not at this point, but it's necessary. And it just makes you feel energized, and to be around people who are like kind, if you will, and to know that it's still possible. And every now and then, even some of the long termers will still go back out, but they don't tend to stay out. They get back in pretty quickly. So
Yeah.
it's just it's been my experience. But as far as books, I mean, there's many out there, and there's a lot of good ones. I'm not going to spout any off the top of my head, but just for me, it's more about talking about it, and interactions with others who are sober.
Yeah, I appreciate that because the graduates from GBR that I talk to talk about how much they enjoy the Zoom sessions after they
Right.
graduate, where they get to interact and be reminded of what they did and how they did it.
Well, you develop a certain camaraderie. I know I did. I actually have two individuals when I got sober, over 20 years ago, who I stay in touch with. They live in different states, and they've pursued different interests through the years, but we've managed to stay in touch, and it's all based on the fact that we went through it together.
Exactly.
And
Exactly. Now, what do you want someone who's looking for a recovery center? What is important for you to share with the people that are looking for the right center for them? What would you say to someone looking at recovery and where should they go about Gulf Breeze?
well, I did. a lot of it's going to depend on, if they've been to previous centers before. I hate to say this. Sometimes there are places where they get you to commit, and then basically all they do is load you up, 2 or 3 times a day and take you to AA meetings. Yeah, and that's pretty much their treatment program, which I disagree with. I think the difference here is all the different modalities that we incorporate. Not only is the approach different with the 3Ps, but there's neurofeedback, there's group therapy, there's individual psychotherapy, and there's the concept of exercise. They go on field trips. There's quite a bit of art and music incorporated into the recovery process. So it's they stay busy. They stay busy and learn how to channel some of that energy that used to be in the pursuance of illicit substances toward more positive things, if you will.
Yeah, that was very good. That was very helpful. What, as we're closing up here, what do you want? What's important to you, Doctor, that you want to make sure the listener knows? What's something you personally want to share with somebody listening or watching this about recovery, about Gulf Breeze, about you? What's something you want to make sure they take away?
Well, that we're really here to help. This isn't jail. This isn't prison. A lot of people feel that way when they've, are having to leave their lives behind. We're here to help, and we're sincere about it. We're going to tailor their program as best we can to their needs. It's not just rubber stamped. Uh, we don't line them up like cattle and say everybody do this and everybody do that. We take the individual's concerns into consideration, and I think that makes a big difference.
I do too. I think if I were looking at a recovery center, I'd want to know that I wasn't, I'd be, want to know that I'd be taken care of and in good hands. Is there anything that I didn't cover that you wanted to make sure to say?
No, I think that's it. I think
All
that's
right.
good.
All right. Well, I think you did a great
Okay.
job. And people are, let me stop recording here.
Well, thank you. I
And
hope they can hear through the Arkansas accent.